Dengue infection is a leading cause of death and sickness in tropical and subtropical parts of the world. Dengue hemorrhagic fever is a more serious form of dengue infection. Primary symptoms of dengue appear 3 to 15 days after the mosquito bite and include high fever and severe headache, with severe pain behind the eyes that is apparent when trying to move the eyes. Other associated symptoms are joint pain, muscle and bone pain, rash, and mild bleeding. Many affected people complain of low back pain. The lymph nodes of the neck and groin may be swollen. Young children and people infected for the first time typically have milder symptoms than older children and adults. Dengue hemorrhagic fever starts with the typical signs and symptoms of dengue as described above. The fever lasts from 2 to 7 days. After the fever begins to abate, symptoms occur that are related to increased permeability of the capillary blood vessels. These symptoms can include severe abdominal pain, prolonged vomiting, and breathing problems. Bleeding tendencies, including easy bruising, nosebleeds, bleeding gums, skin hemorrhages, and even internal bleeding may occur. The disease may progress to failure of the circulatory system, leading to shock and death. Symptoms: many people, especially children and teens, may experience no signs or symptoms during a mild case of dengue fever. When symptoms do occur, they usually begin 4 to 7 days after you are bitten by an infected mosquito. Dengue fever causes a high fever, 104 degrees, and at least 2 of the following symptoms: headache, muscle, bone and joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. Blood vessels often become damaged and leaky, and the number of clot-forming cells, platelets, in your bloodstream drops. This can cause a severe form of dengue fever, called dengue hemorrhagic fever, severe dengue or dengue shock syndrome. Signs and symptoms of dengue hemorrhagic fever or severe dengue, a life-threatening emergency, include severe abdominal pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stools or vomit, bleeding under the skin, which might look like bruising, difficult or rapid breathing, cold or clammy skin, shock, fatigue, irritability or restlessness. Causes: dengue fever is caused by any one of 4 types of dengue viruses spread by mosquitoes that thrive in and near human lodgings. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters that person's bloodstream. After you've recovered from dengue fever, you have immunity to the type of virus that infected you, but not to the other 3 dengue fever virus types. The risk of developing severe dengue fever, also known as dengue hemorrhagic fever, actually increases if you're infected a second, third or fourth time. Risk factors: factors that put you at greater risk of developing dengue fever or a more severe form of the disease include living or traveling in tropical areas. Being in tropical and subtropical areas increases your risk of exposure to the virus that causes dengue fever. Especially high-risk areas are Southeast Asia, the Western Pacific Islands, Latin America and the Caribbean. Prior infection with a dengue fever virus. Previous infection with a dengue fever virus increases your risk of having severe symptoms if you're infected again. Complications: if severe, dengue fever can damage the lungs, liver or heart. Blood pressure can drop to dangerous levels, causing shock and, in some cases, death. Prevention: 1 dengue fever vaccine, Dengvaxia, is currently approved for use in those ages 9 to 45 who live in areas with a high incidence of dengue fever. The vaccine is given in 3 doses over the course of 12 months. Dengvaxia prevents dengue infections slightly more than half the time. The vaccine is approved only for older children because younger vaccinated children appear to be at increased risk of severe dengue fever and hospitalization 2 years after receiving the vaccine. The World Health Organization stresses that the vaccine is not an effective tool, on its own, to reduce dengue fever in areas where the illness is common. Controlling the mosquito population and human exposure is still the most critical part of prevention efforts. So for now, if you're living or traveling in an area where dengue fever is known to be, the best way to avoid dengue fever is to avoid being bitten by mosquitoes that carry the disease. If you are living or traveling in tropical areas where dengue fever is common, these tips may help reduce your risk of mosquito bites. Stay in air-conditioned or well-screened housing. The mosquitoes that carry the dengue viruses are most active from dawn to dusk, but they can also bite at night. Wear protective clothing. When you go into mosquito-infested areas, wear a long-sleeved shirt, long pants, socks and shoes. Use mosquito repellent. Permethrin can be applied to your clothing, shoes, camping gear and bed netting. You can also buy clothing made with permethrin already in it. For your skin, use a repellent containing at least a 10% concentration of DEET. Reduce mosquito habitat. The mosquitoes that carry the dengue virus typically live in and around houses, breeding in standing water that can collect in such things as used automobile tires. You can help lower mosquito populations by eliminating habitats where they lay their eggs. At least once a week, empty and clean containers that hold standing water, such as planting containers, animal dishes and flower vases. Keep standing water containers covered between cleanings. Diagnosing dengue fever can be difficult, because its signs and symptoms can be easily confused with those of other diseases, such as malaria, leptospirosis and typhoid fever. Your doctor will likely ask about your medical and travel history. Be sure to describe international trips in detail, including the countries you visited and the dates, as well as any contact you may have had with mosquitoes. Certain laboratory tests can detect evidence of the dengue viruses, but test results usually come back too late to help direct treatment decisions. Treatment. No specific treatment for dengue fever exists. Your doctor may recommend that you drink plenty of fluids to avoid dehydration from vomiting and a high fever. While recovering from dengue fever, watch for signs and symptoms of dehydration. Call your doctor right away if you develop any of the following: decreased urination, few or no tears, dry mouth or lips, lethargy or confusion, cold or clammy extremities. Acetaminophen, Tylenol, others can alleviate pain and reduce fever. Avoid pain relievers that can increase bleeding complications, such as aspirin, ibuprofen, Advil, Motrin IB, others, and naproxen sodium, Aleve, others. If you have severe dengue fever, you may need supportive care in a hospital, intravenous IV fluid and electrolyte replacement, blood pressure monitoring, transfusion to replace blood loss. Thank you for watching. Please don't forget to like and subscribe to my channel, and please click on the bell so you'll be updated on my next video. Thank you. WeCare for you PH. Your health comes first.